Waxman, who helped the Capps-Waxman Amendment get it passed, specifically allows for federal funding for abortion. So with the actions of his own party and the Senate Finance Committee rejecting a conscience rights amendment, which had been accepted by the House Energy and Commerce Committee, to me it seems like he's not being very truthful to the American people when he claims that federal funding will not go towards abortions.
Thank you, Brian. The Democratic side, Mike.
One really quick point about kind of what you said, Brian, and then I'll get into kind of where the Democratic plan plays into this. You made a quote about the president, and you kind of added on your own line after it. The president did say he would like to see federal funding go to reproductive care. What he didn't say was that he'd like to see it go to abortion. Just because money is going to go out to Planned Parenthood to give out contraceptives doesn't mean that it's going to abortion. The next question is where in the Democratic bill is there funding earmarked for abortion, or is it possible? The question is no. The Hyde Amendment passed in 1976 said that no federal funding will go towards abortion in terms of Medicaid. That would continue under H.R. 3200, under the Wyden bill, under the Baucus plan. You then get into the affordability credits that I talked about before, and what those plans can be used. Now, the Conscious Rights Amendment that you briefly mentioned had the charge that no federal money in these affordability credits that we would give to people who are disadvantaged would go to people to buy a plan that covers abortion. It didn't say that no federal money will go to abortion. It said it won't go to a plan that covers abortion. So that means that if I were to get this affordability credit, I cannot go out and buy a plan as a male that covers abortion. Now, if you look at the statistics, 90% of the private insurance companies out there cover abortion. So I would be limited to using my federal tax credit, that, again, the Republicans are in favor of, only to purchase 10% of the plans in the country. To me, that goes against the entire essence of competition that Republicans have been pitching for the last 50 years. I think it's a sad state that we would have federal money going towards abortion, but what we're talking about is people buying plans that cover abortion, and the amendment that you're talking about and is proposed by Republicans is not going to stop that.
Thank you, Mike. Our final question will focus on the public health insurance option. The Democrats, please explain how your party views the public option in light of the current health care market.
Health care premiums for consumers have doubled since 2001. That's a quote from J. Rockefeller, and that was also proven true by PolitiFact.com. To use a metaphor, look at, we go to Siena College, it's a private institution, and we chose that private institution either because we could afford it and we thought it was a better option, or because it was provided for us through some kind of subsidy or endowment, scholarship, that kind of thing. Now, if that's not possible in a culture that, in a knowledge economy where going to college is one of the best options, then SUNY Albany right next door is also available. Now, SUNY Albany is subsidized by the government, but is an institution which provides that less expensive option. Now, that is necessary also with the public option in healthcare, and that's something Obama's been trying to say since the beginning. The public option, although it is, first of all, to quell a few mistruths, the public option is not paid for, is not free. It is subsidized if a certain income level is not met, and otherwise it is only an option that will, first of all, it will not be subsidized by the government. It was more similar to a post office that will compete with FedEx and UPS, but provide a less expensive and more efficient option. I think where the Republican Party sees fear in this is that the public option will force an industry that has been abusing administrative costs and fighting increases in efficiency and technology for way too long, will be forced into lower administrative costs, increased efficiency, increased communication with medical technology. So the public option essentially would be the best opportunity to decrease costs. The plan will be optional and will include what has been characterized as individual mandates. the mandates are a tax assessed to each individual in the country. So under several of the plans, you will be taxed if you are uninsured. However, that tax will be eliminated if you are not insured, whether that be through, like under Weiner, it would be an individual insurance that's nationwide and increases competition, or under HR 3200 would be through employer-based tax or otherwise. I'm sorry, employer-based insurance or otherwise. Essentially, this would provide a dual system. You can choose the public option without, with mandate, but without